Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to share with you 5 of my favorite exercises to give to patients and clients that are 8 weeks out from knee replacement surgery. I just wanted to give a quick caveat that these are not all-inclusive. Of course, you still want to continue to work on your range of motion and other type of exercises that you've been doing all along the course of your rehab. Also, there's plenty of individuals who may do these exercises earlier in their rehab. There's plenty of individuals who may not be comfortable doing these exercises till later on in their rehab. But this is just from my personal experience, some exercises that are common for individuals that are 8 weeks out from knee replacement surgery. Hope you enjoy. Hey everyone, this exercise is 4-way straight leg raise in standing or 4-leg hip exercise. Great exercise for strengthening the hip muscles. You can do it without any resistance, or you can put a TheraBand, one of the loops, around both legs to add some resistance. Or you can take a longer TheraBand like this, put one end against the table, a leg of a table or something that's not going to move on you, and then loop the other end around your leg. So 4-way, meaning 4 different movements. You're going to keep your leg as straight as possible throughout, and also keeping a good upright posture. So we have hip abduction, coming out to the side. We have hip adduction, so the opposite, crossing the body and coming back to neutral. We have hip extension, coming straight backward. Again, trying to stay up nice and tall throughout. And we also have hip flexion, coming straight forward. And you can see as if you had the resistance bands, how that would make these exercises a little more difficult. I also encourage you to have something sturdy to hold on to. Probably the best thing is your kitchen counter or at the kitchen sink is really sturdy, something to hold on to. You can also use a wall, hold on to a wall, or a chair, or anything that you have that's sturdy. This exercise is step-ups, pretty self-explanatory exercise, but I'll share a few common things and tips. So first of all, you want to step up and make sure your whole foot is on the step as you come up. And you're just going to come up, and either you can step forward down, or you can come right back down. You want to make sure that you're doing it with leading both with the surgical leg and leading with the non-surgical leg. The leg that steps up is going to be the one that is going to do most of the force, most of the effort, and is going to get the best strengthening gains. You want to make sure you have a good upright posture as you do it, standing nice and tall. Try not to lean over, try not to bend at your hips sideways either. Just trying to keep a nice good alignment as you do this exercise. If needed, and if you feel more comfortable, definitely have something to hold on to, such as a railing if you're using just your stairs. I like to put the walker here, if that tends to work for some people. Some people also can use a long walking stick or a pole, or you can do it up against the wall and put your one hand on the wall as well. That's step-ups. This exercise is standing isometric hip abduction. So usually it's best to perform this exercise using a wall. I'm just going to use the massage table here just to get a better able to view it on the video. So I like to roll up a small towel, or you can use a pillow or something like that, just for a little bit of comfort. And what you're going to do is you're going to stand next to a wall. In this case it's the massage table, but you would have a wall here for most people. And you're going to lift up the leg closer to the wall, and you're actually going to then push that leg into the wall or into the massage table. So it's like you're pushing with this type of force, like you're pushing your leg out to the side, but it's an isometric exercise, so the leg actually isn't going to move. You're just going to feel that pushing into the wall. Now, a couple of things with this is you're going to feel it both in the leg you're pushing with, but also you'll probably feel it with the stance leg as well, in the hips. This is a good hip strengthening exercise. You want to make sure that you're not leaning and trying to compensate one way or the other, trying to keep a nice upright posture, good alignment. And usually you want to hold this for about 30 seconds, 45 seconds if you can. That's the goal. And then relax. And be sure to perform it on both sides as well. A great strengthening exercise for your hips and your glutes. This exercise is deadlifts. The thing about deadlifts is people kind of get an impression that you have to have this big, heavy barbell with all these weights on it. But really you can perform deadlifts with relatively light weight and it still has a lot of tremendous benefits. So I have just a light dumbbell. You can kind of play around with what weight works for you. You can also use a kettlebell. You can use a barbell if that's something you're comfortable with. You could use a heavy box that you have in your house. You could use all sorts of things. Find something that's relatively heavy, play around with a weight that works for you. And all you're going to do is put whatever you're using as a weight right in front of you. Spread your legs out about shoulder width or a little bit further. Toes you want pointing forward, or they can point a little bit out to the side. That's okay too. And all you're basically going to do in the simplest form of a deadlift is you're going to bend down, hold on to the weight, and then come back up like this with your arms lengthened. Your arms you want to think about are basically like a rope. So you don't want to be shrugging or doing anything bending with your arms. They're basically just a rope attaching to the weight. Now a couple things to keep in mind is you really want to use a hip hinge technique. So you're trying to, we don't want to bend down like this. We want to do a hip hinge. So keeping the back in a relatively neutral position. You're going to hinge at your hip like a door hinge. The hips are going to come backward as you come down, and then you're going to pick up the weight just like this. An easy cue that I like that tends to help people is that you want to keep your chest pointing up and forward. So if your chest is down like this, then you're probably not in a good position. If you're keeping your chest up as you come down, that's going to help you maintain that hip hinge movement. Again, think about back stays relatively neutral. And then you're also going to bring your hips backward as you come into that downward position. If you find it difficult to bend down that far, you can put the weight or whatever you're using on a step so it's a little bit higher. And then you just don't have to go down, up and down as far, which is perfectly all right as you get the same benefits of strengthening mobility through the knees. A really great whole body exercise. This exercise is hamstring curls, or also bridging on a physio ball. So I'll share two different exercises. So this one you're actually going to be laying on your back, and you're going to have your feet up on the physio ball or the Swiss ball. And I like to do it so you start with a bridge. So you're going to lift your bottom up off of the surface. And then you're going to curl both legs in toward your body and then slowly bring them back out. In and out. In and out. The great thing with this exercise is, of course, it's a great exercise for strengthening your hamstrings. You're going to really feel it in your hamstrings. You might even start to cramp up a little bit, which I experience a lot with some people. But it's also a great exercise for core stability, maintaining your balance and stability on the ball. You can also do just general bridging, so being with the legs on the ball, going up and down like this. Or if you really want to challenge yourself, bring the legs in, and you can bridge with the knees flexed as well.